Hi, my name is Deidre Bailey, and today we will be discussing electrocardiogram and its correlation to cardiac events. Let's begin by discussing what an electrocardiogram is and its function. An electrocardiogram, or ECG, formerly known as EKG, is a test used to evaluate the heart. It is a very fast and simple test that is performed using electrodes. Electrodes are small patches that are placed on areas of the chest, arms, and legs. The electrodes are then connected to the machine, which measures and interprets the electrical activity of the heart. The recording from the machine represents the activity throughout the heart during depolarization and repolarization. In order to provide a common basis, the ECG uses the same 12 conventional electrode arrangements for all recordings. Now that we know what an electrocardiogram is and its function, let's discuss the individual parts of the ECG and how it correlates to cardiac events. The electrocardiogram has three specific waveforms known as the P wave, the QRS complex, and the T wave. The P wave represents atrial depolarization. The QRS complex represents ventricular depolarization. The T wave represents ventricular repolarization. The waves of depolarization and repolarization represent the various contraction and relaxation of the heart. Along with the P wave, QRS complex, and T wave, the ECG also has additional segments where it remains at baseline and there is no net current flow occurring in the heart muscle. The PR segment is the interval between the end of the P and the onset of the QRS. During the ST segment, the ventricles are completely depolarized and the contractile cells are undergoing the plateau phase of their action potential before they repolarize. It lies between the QRS and the T. During the TP segment, the heart muscle is completely repolarized. This segment is after the T wave, but before the P wave. In order to determine the importance of an electrocardiogram, an experiment was conducted for wearable ECGs in order to show how it can effectively monitor the condition of the heart. The experiment indicated how wearable health monitoring devices, such as the ECG, can achieve successful ECG data and monitor whether or not there are any abnormalities within the heart. Cardiovascular diseases are high-risk diseases that cause millions of deaths each year. ECGs are important devices that aid in the prevention and treatment of these diseases. In this experiment conducted, there were 38 subjects. 16 of the subjects were males and 22 were females. These 38 subjects were monitored wearing the wearable ECG device. The device that was called iRealCare 2.0 or flexible cardiac monitoring patch monitored the heart condition. It collected ECG signals and was mounted to the subject's left side of the chest in order to collect data. The data was then transmitted to the cell phone using Bluetooth. The device is worn by each subject, each of the 38 subjects, for at least 24 hours, and each record contains the number of heartbeats. Each heartbeat is marked and is classified in one of 5 categories. The categories were labeled as normal, ventricular premature beat, supraventricular premature beat, atrial fibrillation, and interference. The figures shown in this slide showed the morphological feature of each class of the ECG. The ECG signal processing consisted of pre-processing, PQRS, T-wave segmentation, and frequency analysis. Each segment played an intricate role in monitoring the heart. The heartbeat of 10 of the 38 subjects were used as 10 training sets, while the other 28 subjects were classified in one of the 5 categories listed. Upon conclusion of this experiment, it was shown that the wearable ECG device and the methods used with this device were effective in monitoring the activity of the heart. The device would be an effective method to use in order to effectively treat patients who have developed cardiovascular diseases. Now that we have discussed what an electrocardiogram is and its function, and even the benefits of using a wearable electrocardiogram device, let's now discuss the benefits of getting an electrocardiogram. An electrocardiogram can be used in many ways to aid in the treatment or prevention of cardiovascular diseases. An ECG can detect heart problems or check on an existing problem. It can uncover the cause of chest pains or chest fluttering. It can be used to evaluate shortness of breath, chest tightness, or any other heart-related symptoms. It can also be used to check for abnormally fast or slow heart rates or an irregular heartbeat. It can determine the overall health of your heart, or it can check your heart before or after undergoing heart surgery. If one is taking medication for heart disease, the ECG can check to ensure that the medication taken is working. It can also see how or if a pacemaker is working. An individual with a family history of cardiovascular disease can also get an ECG to monitor their heart due to family history. And overall, an ECG can ease any tension one may have if they experience any unusual chest pain or symptoms. An ECG can determine whether anything is wrong or ensure that everything is fine with your heart. In this presentation, we discussed electrocardiogram and its correlation to cardiac events. We begin by discussing what an electrocardiogram is, its function, the individual parts and its correlation to cardiac events, the individual segments of an ECG. We discussed an experiment that was conducted using a wearable ECG device. And we also discussed the benefits of getting an ECG. Thank you.